So the 5 things that you want to help your clients understand when we're talking about helping them with the one plan that can fit into their budget, because it's important that they understand how health insurance works. First off, what will their plan do when they're admitted to the hospital? In other words, what is the out-of-pocket maximum when they're admitted to the hospital that they're responsible for? An HMO or a PPO will have an out-of-pocket maximum in network. However, it's important that they also have an out-of-pocket maximum out of network. And then does their plan limit certain procedures like transplants? Then they need to have a good understanding of deductibles. These can be written in a couple of different ways. If the deductible applies to their whole plan, things like inside and outside the hospital, they may want to take a low deductible. So a $500 deductible for each family member would mean a family member would have to incur $500 in expenses before the insurance would pay anything. The higher the deductible, the more out-of-pocket their expenses will be. However, the more risk they assume, the less they're asking the company to assume, and the lower their premium. So a family of 4 in this example would have an outlay of $2,000. So where do they want to have their deductible? On the hospital admission or on the surgery? Things outside the hospital could be no deductible copay or a small deductible. When they are admitted to the hospital, they're most likely to hit any deductible they have. So if they have a $2,000 deductible or $10,000 deductible, when they're in the hospital, they're probably going to hit that deductible anyway. So the real question might be, what will your coverage be after the deductible's met? Think of it this way. If you have a $500 deductible in an 80-20 plan, and you have a 20% of approved expenses, and the insurance company pays 80%, what would you pay for a claim of $100,000? After your $500 deductible, then you're responsible for 20% or $19,500. That's the way deductibles work. So it wasn't the deductible, right? It wasn't that $500 deductible that hurt. It was the percentage of the coinsurance that you had to pay. So the question that you have to ask yourself is, would you rather have a $5,000 deductible on a 100% plan or a $500 deductible on an open-end 80-20 plan? And your client's answer will help determine what their monthly premium is. So if your deductible is for the major things like hospitalization, admissions, you could put other things on your plan to pay for the day-to-day medical expenses with no deductible, copay, or small deductible. So in building a plan to fit in their monthly budget, what would be the most important thing to have on their plan? An out-of-pocket maximum, right? It doesn't matter if you get an 80-20, 70-30, 50-50. At some point, they probably want the company to start paying 100% of their claims. Isn't that correct? So once you know your out-of-pocket maximum, you can decide what type of health plan you want. Number 3, what does the plan cover for outpatient procedures like chemo, radiation, or outpatient surgery? Listen, most plans say they cover chemo, radiation under any hospital admission. But here's the thing. If they're diagnosed with cancer, they're probably going to give them a pop of chemo while they're in the hospital just to see how they react to it. And then they're going to release them. They're going to get most of their treatment as an outpatient. So their future treatments are going to be done on that outpatient basis. What will their plan cover? And what will their out-of-pocket expenses be? Most plans come with some kind of prescription drug. So if all you want to do is pick a one-time antibiotic, having a limit like $300 a year per person may be fine. However, if you're on some type of maintenance medication, such as heart, cholesterol, diabetes, or something else like that, are maintenance drugs covered? What is the limit, if any? What is your plan when you reach that limit? And the last one, the 5th one, is how does their plan cover outpatient testing, therapy, and ambulatory care? Many plans have copays when you visit a doctor. The question to ask is that copay or $35 or $50 for the visit why you bought a health plan? The real question that they have to answer, the thing they have to consider, is what happens when their doctor wants to run a bunch of tests? Do they fall under the category of ambulatory care? Many plans will pay after coinsurance, but tests are often not covered. So would they prefer to pay that $35 or $50 copay for the doctor visit and let the company pay for the test? the test interpretations, or any other physician's occupational or speech therapy, and then be aware of daily limits. So those are the 5 things that people need to understand about health insurance. So let's talk about what you can do to help them move into more affordable coverage that fits into this budget. So Alera is a healthcare plan that American Eagle has started to work with. In fact, one of the things I like about American Eagle is they not only do they know their products, but they use most of their products. So today we're going to talk to Cliff Woodruff. He's the Vice President of Sales for American Eagle Consultants. He's also a customer of Alera. I feel like that TV commercial. He's also a customer. So he's going to talk to you about their healthcare plan. They have affordable low-cost plans, coordinated care approach, nationwide healthcare coverage for travelers, medical help when at home or on the road, access to board-certified physicians, and cost-sharing plans that save your clients money. So, Cliff, you with us, buddy?
I'm here. I appreciate you having me on today.
So
yeah, I was going to go over my.
So the plan covers telemedicine, preventative primary care, labs, diagnostics, and urgent care, right?
It does. And I'll give you kind of the genesis of what happened. Is we had your traditional group major medical. The prices kept going up and up and up. Really got to the point it was unaffordable. So in lieu of that, I had to go out and find my own coverage. And through a lot of research, I'm sure that most people on this call have probably done, I looked at the ACA. That's what's supposed to be the Affordable Care Act. Looked at those plans. I have 4 dependents, 3 of those dependents being children under the age of 5. Looked at those plans. The deductibles were extremely high. Coverage was pretty minimal. And honestly, the cost was no better than what we were paying on the major medical group. So that really was not much of an option.
What were you paying, Cliff?
It was $2,400, and it was going up to $2,800 a month. And that was, I believe, a 90/10 coverage with a $1,000 deductible. Again, it was just getting so astronomically expensive. And again, ACA did not seem to fit the bill for our needs, because we are going to be using the plan with young children every year at least once, probably more than that. Then, of course, I looked at the short-term medical, the mini-meds, indemnity plans, and they were affordable. But the coverage, again, was not exactly what we were looking for with our particular situation. Something major happened. And even at, with the young kids being relatively healthy, it didn't necessarily fit our needs. So it didn't really work out for us. And then I got thinking, I was like, we know people in this market, call them. And got a hold of a group who sells a lot of not major medical, but a lot of underage health products. The owner of that company actually has Alera Health, and I'd heard of them before in the cost-sharing plans, and spoke to them. They're very, very knowledgeable about this arena, and the plan was good enough for them, answered all my questions and concerns I had. At that point, decided we should probably move forward with that type of product. And again,
so you were looking for something that covered off visits?
Office visits were most important. Yeah, we have we have the inoculations, we have all the well visits that are required for children of that age. Of course, ourselves, we want physicals and things like that too. This plan covers all those things. Actually, what I've found with this particular plan is their philosophy essentially is pay more up front, not the client, but if they spend more money up front, they'll spend less money on the back end on the major catastrophic amounts. So really their plan is to keep you healthy, allow you to use your plan, as you see fit. And depending on which one you go with, obviously, $20 primary care physician copays that are unlimited throughout the year worked out great for us. It's actually a little bit cheaper than what we were paying before at $35. And again,
so you're
for
using
the children,
these preventative services, right?
Right, using the preventive services. And so far, we've used them a couple of different times. And actually the process that we go through, and they kind of suggest this, and it works out well. They have a thing, the Teledoc. So the Teledoc, you can use it unlimited. You can use it multiple times a day. You can use it 365 days a year. You call in, there's no copay, nothing to meet. It's free. It's included in your plan. You call up, you speak to a representative, essentially like the nurse would do when you show up to a physician's office. They ask you your questions, get a little information from you, what the issues are. So, you'll have a doctor call you back in 30 minutes to an hour. and within that time frame, MD or LPN, I think, can also call you back. But in our case, it was an MD. My wife had a sore throat. They called back, listened to her, told her it sounds like she has strep throat. So at that point in time, they said, you know, you need to go to the doctor in this case, because they can write a prescription for you directly if it just happens to be something minor. So they suggested going to the doctor. We called our primary care that we'd been using with our previous insurance. They're in the network. It's a massive network. My wife went in, paid the $20 copay. They did the strep test. She was positive. They wrote her a prescription, and she was out of there for $20, and could have been less than that had the, you know, diagnosis been different with the Teladoc. Of course, they said, you know, there's a carrier in your house. You need to have everyone checked, or someone checked, whoever seems to be the most likely culprit. We looked at all our kids. One had a runny nose and was eating less than normal. Took her to the doctor, $20. She also had strep, got medication for her. So it's been a seamless process, performed exactly as it was explained. And again, the Teladoc is a fantastic product, which I'd never really considered. I'd heard of it before, but I never really considered it until I used it, and I was pleased with it.
So they've got 3 different kind of plans: the value, the plus, and the premium, right?
Yeah, they have 6 really on this particular product. So they have 6 levels. The value, plus, and premium are kind of the lower echelon levels, and then they have the gold, silver, and bronze on the more robust.
Let's look at the value, plus, and premium here. So it comes with the telemed, preventive care, primary care, labs and diagnostic, urgent care, chronic maintenance, prescription discount program. How's that prescription discount program working for you?
It's been fine. You know, actually, some of the prescriptions, I didn't know that this was actually the case, but Publix, you know, they'll tell you where to go currently to get the best deals. Publix is giving amoxicillin for free. So that part worked fantastically. I hadn't used it too much except for those 2 prescriptions, and they turned out to be free. So far, so good.
All right. And then, so this is what, now, you know, there's a lot of information to give in a short little webinar. So I'm going to show you how to Cliff's contact information. You're probably going to look at one of these plans that we show you and think, I'd like to know more about that. So at the end of this, I'm going to give you Cliff's contact information. You can reach out to him. You'll get an email after this, and you can reach out to him. We'll send you the brochures. The only reason we don't have the brochures attached to the email you're going to get is I don't know which one you're interested in. If you're interested in all of them, we'll send all of them to you. What the heck? But we'll tell you how to get this information. So this is the value plan. One of the things I want you to focus on at the bottom here is the rates. So the rates are incredible. You can't beat the rates. Now this is the plus plan. Again, look at those rates. And these plans mirror any other kind of health insurance that you're looking at out there in the marketplace. So I'm also with Cliff. I have an individual health plan. My plan's gone up repeatedly. Every year I look at it. I'm looking at how many times a year I go, what my urgent care is, what my out-of-pocket plan is, and you just can't beat this. And that's the premium plan. So that's going to be the most expensive of these type of plans. And then Cliff showed you there's 6 of them. So there's a bronze, silver, and gold. These are enhanced offerings. They have the cancer sharing available immediately, in and out of network sharing available immediately, unlimited primary care, urgent care, specialty care. So it has everything you see there on the screen under enhanced offerings. So it's these plans here with these additional benefits for you. So let's have a look at those. Let's kind of drill down on this. Here's your bronze plan. You see your primary care, your specialty care, your urgent care up there. Wellness and preventative is 100%. That's what I think is incredible about it, because it covers all kind of the preventative. I had that on a previous screen. And then this shows you what your deductibles are. So that's the bronze plan. And which plan did you get, Cliff?
We went with the gold plan.
All right, so that's the bronze plan. I'll give everybody just a second to have a look at those premiums there. That's pretty incredible, right? You can't beat that. The silver plan, so we went from primary care at 50, 125, and 100 to 35, 75, and 75. So look at the premiums down there. So here's these premiums at 50, 125, and 100. These premiums for 35, 75 and 75. And then the plan, I'll let you talk through the gold plan if you would, Cliff.
All right. Yeah, the gold plan is what we went with. We went with the $2,500 MSRA, which is their verbiage for a deductible. So they kind of fit our budget there, and saved us a lot of money. The way they do the rates or the pricing is it's the oldest person in the household. My wife just turned 40 actually, so we got the 40 to 49 bracket there for the family plan. So we got an 80-20 coverage, and again, it comes with all the other stuff, the 100% wellness and preventive, the unlimited teledoc, which again, I think is pretty nice, a lower copay at the primary care physician than we previously had, along with the emergency room charge, the urgent care. But anyway, we ended up paying $1,200 for this plan, as opposed to what we were going to pay was $2,800, so more than 50%, maybe 65% off, 60% off. And on top of that, being an insurance agent, I was able to write myself. So then, of course, you get the commission on that, and you get even cheaper price. Like I said, so far there's been
the $20 copay when you go to the doctor, $1,000 deductible, and an 80-20 plan, right?
I did the $2,500 deductible. Easily could have done the $1,000, but yeah, just chose to go with that one to kind of fit our budget.
Right.
Figure, like you said earlier, if you're going to start using that 80-20, something catastrophic has happened. And, not much of a difference at that point. So, we went with 2,500.
That's sharp. And the preferred brand drugs at 50% cost sharing. So that's a good deal.
Yeah. And like I said, it's, and they have the mail order option as well, for your prescriptions. And it's been a very smooth, process in general. A little bit different maybe than some of the traditional major medicals you're used to. When you receive your welcome kit, it'll have your instructions for registration for your discount card for your prescriptions. It'll tell you to register for the teledoc ahead of time so you don't have to waste time while you're sick. It's real user friendly, and it's been a great plan for us so far. Tremendous savings, and like I said, we've utilized it twice, and zero issues, zero concerns.
So it's January 22nd. The plan started January 1st, and you've already used it twice, plus you've used teledocs a few times, right?
Mm-hmm.
Good deal, pretty good deal. Now, they have some other plans too, right?
They do. They actually have some plans, which I'm looking at for younger individuals. My wife manages a dental office, and they have individuals, and they don't offer group. A lot of the people there have group through, say, their spouse's employer. Some of the people there, 25-year-olds, not making a ton of money, but they're not all that concerned about the catastrophic coverage or anything like that. They just really need their physicals. They need their consultation fees at the primary care, stuff like that. So there are plans that are actually designed for people who are young and in good health and may not want to pay the extra money for, the catastrophic coverage. And it basically cuts off the plans we looked at halfway down the sheet. You have emergency room, you have urgent care, you have the specialty, you have the primary care. They just may not include the $1 million catastrophic coverage, stuff like that. So they really kind of cut these plans up into pieces and bits and pieces that might fit a specific person, either their budget or their preference, without having to go all in and get the gold plan like we did in our situation. So they really are custom designed for almost every single specific circumstance you might come across.
This interim care plan we have on the screen here now, everybody's on the call. This is an actual brochure. I just took a screenshot of this first part of it. Again, I'll give you Cliff's information at the end of it. You can reach out to him and get whatever brochures you want on this. So this is a temporary health plan. This is short-term cost sharing from 1 to 11 months, Cliff.
Mm-hmm. It is.
Anything else you want to tell us about it?
Well, this is kind of referring to one of the ones I was speaking of earlier. Someone's younger who's healthy, not worried so much about the overall. They just needed something that's affordable that gets them into the doctor. If they have the flu, they can get coverage and things like that. So this is really one of the plans I was referring to for someone in that mid-20s range. Hourly employee, does not receive benefits from the employer. A good way to plug and play.
All right. And then this is the Care Plus Advantage for more emergencies. Don't need to overcome your life, right? So
yeah, this is actually kind of the opposite. Yeah, this is the opposite of what we were talking about. Kind of, it's someone who's not planning on going to the doctor. Maybe it's a young man who's just, not that kind of person to visit the doctor, but they do understand, accidents happen, and they might be in a car accident. They might be in, well, anything really. Anything can happen, and they want to protect themselves on the high end of things. They may not mind spending $100, going to the doc in the box.
Yeah.
So again, this is kind of where, like I said, they've cut it up into pieces and offer you what you want or what your client wants, depending on their particular situation and what their concerns are.
Yeah, and again, this is just a screenshot of the brochure. Cliff can get you the actual brochure. And then, so this is kind of how the plan's put together. You have Trinity Health Share, partners with MultiPlan and First Call Telemedicine, along with Quest Diagnostics. Everybody in the insurance industry has heard of Quest Diagnostics. Kemper Insurance, you've all heard of Kemper, everybody knows them. And IHC Group, who doesn't know the IHC Group? So great backing, great financial backing here. All these get together and put together these different plans for you. And these different plans, so let me just go through some of these questions for you, Cliff, because we're getting questions in here.
Mm-hmm.
So the first question, it says, I came in late, are these prices monthly? And I answered yes, right, Cliff?
Yes, that is correct. These are monthly.
All right. How on the bronze level plans do they treat outpatient cancer treatment drugs?
We'd have to go back and look at the bronze plan to be able to tell you right off the top of my head. Like I said, I'm more familiar with the gold in this particular instance.
Yeah. So why don't
reach? Oh, go ahead.
Why don't you reach out to Cliff after this? I'll show you his contact information. He can get you the brochure, and we can answer your specific question. Go ahead, Cliff.
Well, I can't say as far as the gold is concerned, they do have immediate cancer coverage. So it will pay, if you get cancer 2 months down the road or whatever, it will pay for cancer immediately on the gold plan. And I'm assuming bronze is going to be at least something very similar to that.
Okay. And then Joe wants to know, would we expect knockout questions? And are these annual certificates of coverage?
They're continuous, they're not annual. As long as you continue to pay, they're going to continue to cover you. Knockout questions is not really, it's more pre-existing questions. So if you do happen to have something that just happened, there's limited coverage available for that. I want to say it's like up to $20,000 after the MSRA is met. So if you had a heart attack 6 months prior, for 24 months, you're going to be considered pre-existing on that. They will cover up to $20,000 after you meet your MSRA. So there is coverage available for that, but it is considered pre-existing.
So you need to really go through the brochure with them to talk about case-specific type of things.
Right.
All right. So let me kind of bring this in. So just walk me through the process again. So you said when you sign up, the member contributes, which is their way of saying you pay your premium.
Mm-hmm, mm-hmm.
And then they activate.
Yeah, they like to use all these.
So what happens when you get activated through the website?
Well, again, once you sign up, it takes about a week. You receive your cards, and of course, you go through the application process. You'll receive your packet, or you can go directly to this member activation site. It's where it directs you anyhow. You register your information. Say you've received all your information. That's where you also can sign up for your teledoc and for your prescription discount card. It's essentially that easy on the activation aspect of it. It's very seamless. Then, of course, after that, you would want to look at the MultiPlan PHCS network. For us here in Atlanta, it's tremendous. It includes Northside Hospital, Piedmont Hospital. All the doctors that we had on our Humana plan have all been on this network, so it's a tremendously large network. So once you find out that your doctor's on there, like I said, you can call the teledoc, deal with them if you're sick, or you can probably go to your primary care physician you use currently. If not, you'll have to find someone else, obviously. But that's an easy process as well. You go to the doctor, they take care of it from that point. You pay your copay, and at that point, they file the paperwork with the Alera, and Alera sends them the money. So it works a lot like what we're used to with the.
I got a question here from somebody that lives in Illinois. Illinois just reduced the short-term 12-month plans back to 6 months. How would that affect this plan?
I don't believe that it would affect it, honestly. I would have to research a little bit more. A lot of these are the faith-based plans. Yeah, but these are the faith-based plans, cost-sharing plans. A lot of them are exempt for the most part from a lot of the requirements of other areas that I've noticed. But I mean, we'd have to research that one in particular. But I would imagine it would not make a big difference.
So this person should reach out to you and get the specifics on it with you.
Yes.
All right, and then somebody asked what the commission is on these plans. It's a great question. Get a hold of Cliff. Depends on your state and a couple other things. But then the other question is on the interim plan. Can you renew after 11 months?
Yeah, you can always renew these plans. Again, you'll have to go through the process again, and they'll have some, depending on the plan, the pre-existing questions. But you can always renew the plans without a problem. Again, with these plans, it's not so much they turn you down. It's really just, do you have something that's considered pre-existing?
So, some of these questions, you guys are asking great questions. Some of them are questions that Cliff probably needs to answer directly with you. So are these plans for short-term options and aren't a permanent solution for healthcare insurance, correct? So, I mean, like on the one plan, you can keep, as long as you keep paying it, you keep the plan. But those are things you probably need to talk to Cliff about directly. So what I'm going to do is I'm going to give you Cliff's information. So what you can do is you reach out to Cliff. He's the Vice President of Sales, American Eagle Consultants. His email is cliff@aeci.us. We can email you all these brochures, but you really should talk to Cliff. If there's anything that is state specific, Cliff can look that up and get that information for you right away. When we're done with this replay will be put on AECI's website. You can also reach out to Will Smallwood. He's the president of the company. That's his email address. You can reach out to him directly. This isn't an 800 number. This goes straight to their phone, right to their phone. So they pick up the phone up and answer it right there for you. And that's the website. So Cliff, you did a great job sharing all this. I know there's a lot of questions. I hope everybody reaches out to you for their specific questions. You have any final thoughts you want to tell them? Like when they reach out to you, what can you do for them? Like you'll give them the commission levels depending on where they're at, what the contracting process is. You can get them a copy of the application. So now it's a one-page application, right?
Yeah, one or two. It's electronic. I'm trying to think back. Again, it was demographic information. Then it was, have you had an experience, an issue for the pre-existing questions. Do you smoke? Do you drink? And that's essentially it. And at the end, payment plan. So 1 or 2 pages.
All right, sounds good. So today we've brought to you by American Eagle Consultants. My name is Lloyd Laughlin, Power Behind the Sales. You can always go to Power Behind the Sales and get more of the training. If you got any more questions, make sure that you reach out to Cliff at.aeci.us, phone number 678-426-1503. This is being recorded, and we'll post it up on the website. All right, Cliff, thanks a lot. Talk to everybody later.
Thank you. Have a great day.